19-year-old Leslie Cohen has been admitted to the hospital for an exacerbation of Crohn's disease. She has just been prescribed hydrocortisone and her boyfriend Josh is wondering how it will affect her well-being.
Hi, my name's Charity. I'm the nurse taking care of Leslie today.
Hi, I'm Josh. I'm Leslie's boyfriend.
Nice to meet you.
I was just wondering about the steroid that Leslie's taking. Is her medication the same one that weightlifters take? Will it help her build muscle and help her with weight gain? And will she get roid rage when taking these?
Those are really good questions. I will first need to ask Leslie about discussing her medications with you. Hello, Leslie. My name's Charity and I'm your nurse today. How are you feeling?
I'm very tired.
Oh, I'm sorry to hear that. I will try not to take up much of your time. I'm wondering if I can talk to you about your medications with you and Josh.
Sure, we can talk about it right away.
Okay, I'll let you rest for a little while and be back in 15 minutes to discuss the medication with you and Josh. Is that okay?
Yeah, that's fine.
Hi, are you still feeling up to having the discussion now?
Oh, yes.
Okay, Leslie, before we talk about the medication, I would like you to tell me a bit more about your understanding about Crohn's disease.
I know that it means that my intestines get swollen and it's really painful and hard for me to eat sometimes.
That's right, Leslie. Could you tell me a bit about your understanding, Josh?
Well, I know that it hurts her stomach a lot, but I'm just not really sure why.
So in Crohn's disease, the body has a reaction where the immune system attacks the intestines and this causes swelling or inflammation. The body then also has a hard time with digestion, which causes the symptoms that Leslie is experiencing, like weight loss, diarrhea, fatigue, and stomach pain.
Okay, so how are the steroids supposed to help Leslie?
Well, these steroids are different from the one weightlifters use, and they are made naturally in the body and help to reduce this swelling.
Oh, they just reduce swelling in Leslie's intestines and help them work normally, and they would make her feel better?
Yes, that's right. By reducing the inflammation, they also help with her symptoms because the intestines can start working like they're supposed to. Corticosteroids are usually used in Crohn's disease to help with flare-ups like the one that Leslie's here for now. It's kind of like if you would imagine that Leslie's intestines are on fire and hydrocortisone is the water that puts it out.
So will I be taking them all the time?
That is something that you'll have to discuss with your doctor, but there are some important side effects to watch for when using drugs like hydrocortisone for any period of time. These side effects can include increased stomach pain, black or bloody stools, and if you have a fever, that means you could have an infection and you need to see your doctor right away.
Okay, I'll help Leslie watch out for these things.
That would be great, thank you. There are also a few other side effects that are common with these types of medications. These are things like acne and weight gain, particularly weight gain in the face.
So what causes the weight gain?
Corticosteroids like hydrocortisone have a side effect of increasing appetite, so the weight gain usually comes from eating more calories. If you have any concerns about the side effects you experience, you can call a nurse through telehealth at any time or also call your doctor.
That's a lot to remember.
I will be sending an information sheet along with you and Josh for you to refer back to when you need. There are also links to websites where you can find information we talked about.
Okay, that sounds good.
Also, even if you experience some side effects, it is important that you keep taking the medication if you've told your doctor about these side effects and he still wants you to continue the medication. Stopping a corticosteroid medication very abruptly can be very dangerous and should be done only with the supervision of your doctor.
Okay, I'll remember that.
So now I would like you to tell me more about the information that I gave you, like you were teaching your family member.
Okay.
Josh, can you tell me about Crohn's disease and how hydrocortisone helps its treatment?
So Crohn's disease is when there's swelling in the intestines and it causes problems like weight loss and diarrhea. So medications like hydrocortisone help reduce the swelling and make the symptoms go away.
That's correct. Now Leslie, can you tell me what side effects of the medications are important to watch for and what to do if you experience them?
If there is blood in my stool and my stomach ache gets worse, and if I have a fever, if any of these happen, and then I'll call the doctor immediately.
Yes, that's exactly right. It sounds to me like you know all the important facts. Is there anything you have questions about or would like to talk about?
So I was also just wondering if hydrocortisone can cure Crohn's disease.
No, the hydrocortisone is only used to manage the inflammation when there is a big flare-up like the one Leslie has. Unfortunately, it's not a cure, but Leslie's doctor is running some tests and will talk with both of you about the medication options to control the disease.
Okay.
Would you like to talk about anything, Leslie?
So I'm not sure. Do I stop taking the medication if I have any of these bad side effects?
No, Leslie, like the nurse said, it's dangerous to stop it abruptly, and the doctor should be the one to tell you if you can stop taking it.
Okay, that makes sense.
That's right, Josh. Thank you so much for clarifying that. Okay, well, I'm going to leave this information sheet with you so that you have all the information with you.
Thank you.
You're welcome. There are links listed as well to websites where you can read more.
Okay, thank you.
Okay, I'll let you have some rest now. It was nice to meet you both, and I'll be checking back in a little while.
Okay, thank